Hey everybody, welcome back to the MedBears channel, and in today's video we are going to be doing an ethics sort of discussion. So Herman, why don't you introduce what exactly we're doing here?
So what we're going to be doing today is I have come up with some really hard ethics questions, really serious dilemmas doctors have to face. Sometimes it's unprecedented on what has happened before, and I'm going to pose it to these guys, and they're going to try to answer the best of their ability. I want you out there to answer as well. Put it in the comments down below. Let's see if you were correct. These are pretty crazy. So let's jump into case number one. Okay, you guys ready? How do you guys feel about this? Have you ever had to face ethical dilemmas?
Yeah, I think there is training like this in medical school, but let's just see where this goes. This might go in a quite divergent direction.
We've never heard these before.
Yeah, we've never heard these.
These are brand new and some of them are really hard. So let's get into case number one. So there is a doctor that has a disease that interferes with his ability to treat patients. That is the premise of the case. Okay. So there's an anesthesiologist. He's on staff at a hospital. He went to see a fellow doctor as a patient. So you are now in the position of that fellow doctor seeing this anesthesiologist. Okay. This anesthesiologist was having brief lapses of consciousness related to complex partial seizures, a form of epilepsy that has gone unrecognized during his residency. So he didn't know he had it. He admitted to having at least one seizure in the OR that was so brief that no one observed it. The condition was treatable but left the second doctor uncertain about whether to uphold, that's the second doctor, you guys, you are uncertain about whether to uphold the privacy of the doctor-patient relationship or do you inform the hospital staff. Let's give you guys a second to think about it and
I don't need a second.
Start with Beneath.
Obviously, anything that interferes... Okay, it's not obvious. This is me being good.
This is a little bit of a discrepancy here, though.
Sure. But I personally think anything that could potentially cause damage to patients, you have to report it. Personally. That's my opinion. Imagine if he has a more intense seizure in the OR. Like, what are you going to do? Kill the patient? Like, just to uphold some HIPAA? Like, of course, HIPAA is very important. It's a huge priority. But I would never prioritize it over another patient's health.
Okay, first impressions, Shaman, you?
Yeah, I think that's a general principle. I think HIPAA is definitely really important, but I think there is points where HIPAA goes too far. Yeah, HIPAA should be overruled in certain instances, and that is like we are taught that. And so I think in this case, especially in like the OR, if it's like, it depends on what case it is, how common it is. Obviously, you want to look into more specifics if this was an actual real scenario. Like I would want to know so much more details, but from a general overview, it seems like it has the possibility to cause harm to patients, so I would have to report it.
Yeah.
So what would be your exact first steps? Who would you go to? Who would you report it to? Shaman, start us off.
First, I would be honest and open with the doctor/patient and tell him what I'm going to do, tell him what his thoughts are, get his input. And from there, after I do that, I would probably, so you said he's an anesthesiologist, right?
So very important, like Shaman said, you talk to the patient, he's your patient, and tell him exactly what you're going to do, and then I would go to his employer. I wouldn't report him to the boards. I would just go to the employer, let him know what the situation is and how he may potentially be a danger to his patients due to this condition. Not tell him more than that, like not more history than is necessary. Just pretty much say that he may have something that if you could also get consent from the patient, like how much can I share? Like should I say that you have these mild seizures, or do you just want to leave it like, okay, there's something impaired, whatever he describes, and then go to the employer and then have the employer take care of it. And most likely the employer's going to put him on leave or something.
Very good. So I will give you guys the exact scenario of what is optimally what you're told to do. So the next best step would be, as a doctor, to have a discussion with the anesthesiologist and let them know, look, this is a dangerous condition. I'm going to give you a chance to report yourself. That's very important in this case, considering if you just go and report them, it might scare other doctors in the future. So you must kind of encourage the patient to go out, or doctor in this case, to go and report himself. The outcome of this particular case, these are all real cases, by the way, guys. The anesthesiologist's condition was treatable. His doctor told him it was serious enough that he could not honor his privacy if the anesthesiologist did not notify his chairman. The anesthesiologist notified his chairman and resigned his position. A note in his file ensured that this information would be forwarded to any hospital he might apply to in a future position. It would be up to the hospital. It would be up to the hospital to further evaluate the anesthesiologist to see if he was capable of working safely with patients. So this would give. Let me just drop that into you guys as an additional question, which was not addressed here. Would you allow this person to work?
I would. Well, it depends on in what setting, right? So like I would give him a position that isn't that acute, maybe not even like OR related. If I can find a job for him outside of the OR, especially outside of like acute cases,
well, he's an anesthesiologist, so how's he going to be outside the OR?
Well, like he can, like I don't. Again, we can find something like pre-op,
pain management, pre-op.
Yeah, like there's tons of things that you can do. That.
Or I was thinking maybe just having him always work with a CRNA.
That's another thought I would have as well. Somebody to constantly be there just to specifically monitor him would be another solution to this.
Yeah,
problem.
so definitely I would not just fire him and get rid of him. I would find another role for him.
Case number 2, where we get into some family matters. This is when things in ethics usually get pretty dicey. So this is a family that's fighting over continuing their mother's care. Very common case.
Very common.
A mother of 4 children entered into the hospital after suffering a massive stroke and was put on a ventilator. You might have lots of stories like this going on right now with COVID.
Yep.
Doctors believed that she would not regain brain function. One of her sons got to the hospital first and told the doctors that should his mother suffer heart failure or any other irreversible complication, no measures should be taken to save her life, aka make her DNR, DNI. Doctors worked under that assumption until one of the woman's daughters arrived and claimed that her brother wasn't interested in helping their mother. He had pushed to put their mother in a nursing home, the sister said, and added that she wanted to do everything possible to extend her mother's life. The mother was widowed and hadn't specified which of her children was to make the decision on her behalf. The doctor has to choose which wishes to follow. What do you do? Now we get dicey, folks. Get in those comments below.
Yeah, if you have responses, type them in before we tell what we would think. That makes it more interesting.
Well, there's like an actual course of action you usually do. So you usually look to see if they have some sort of living will present, if they have some sort of documentation stating what they usually though if they come into the hospital, the first thing you do, even if they have documentation, is figure out what their DNR DNI status is in the hospital. And usually patients will say, I already have a living will. You just ask them what they want for this stay. Then if that fails, then you look to spouse, like Herman said, she's widowed, so that's okay, knocked out. Then you go to kids, adult children, and now we have a conflict with adult children, and I'm assuming you don't have a living will. I'm assuming now she doesn't have a husband either, and if it was up to me and I had, how old is she, you said?
The mother is 65.
Oh, I think I would.
See, all this has been altered for patient safety, but roughly 65.
Yeah, no, I think I would consider her full resuscitation, full intubation status.
So, okay, so you would go along with the wishes of the daughter that came in.
Yeah.
Okay, and your reasoning being? My
reasoning is that you don't have anything to consider otherwise other than a son who we're having conflicting opinions about. And what are you going to do? The only other option is, okay, she could die. Like, I think that's far worse of an outcome than the latter.
Yeah, so you're putting up to debate the outcomes of life,
in an
death.
Alternative, what if she didn't want that, and then now you killed her? Like,
exactly, and the alternative keeping her alive is far worse than the shaman.
Yeah, so I think Beneath gave a really excellent response, like basically really thorough. I will say one of the things that you can also do if you're really like interested. Again, this is a common thing that's asked every time you go into the hospital, like. A random patient that has like no chance of dying still gets asked if they want to be do not resuscitated or intubated. And so often, and I actually did this on my team during my rotations, they'll be like, hey, shaman, can you go look into like past medical records or past hospital visits and see what she said? Because this is a pretty common question, and it probably is in there, at least at the hospitals that I was rotating at. So that's the only thing I would add on to Paneet's answer. Otherwise, they're really good. And I agree with what you said was the conclusion as well. If there's one kid that doesn't want her resuscitated and one kid that does, the default would be to resuscitate her.
Yeah. Okay. This is going to be interesting to read the answer to this, guys. I wasn't even expecting this answer. So without a spouse involved, like Beneath mentioned, next would be spouse, but then you go to children. So without a spouse, the
parents? Is that the one thing?
No, I know you can go to the parents.
You can go to the parents, but in this case,
but 65 there are none, right?
Yeah, there are none, and children come before the parents.
Yeah. Okay.
And so without a spouse involved, the responsibility for end-of-life decision falls on the patient's children, and without a designated healthcare proxy in place, all the children hold equal weight. In cases like this, very interestingly, Doctors have to focus on what the patient, not her children, will want.
Yes.
That means
Exactly.
looking for examples of substituted judgment or statements that the patient may have made
Yes.
that gave clues about her wishes.
Absolutely.
If while watching benign things you wouldn't even really consider in a medical setting, you would think in a legal setting, but would uphold if the patient was watching ER and she randomly just commented, "I'd rather be unplugged than being in a vegetative state," you can literally bring that kind of information to the table, which will have significant weight as to causing an outcome. So everyone would be asked in this situation, everyone that knows her, to give their recollections about her.
I agree technically with that answer,
Yeah.
but let's be real.
Yeah.
They're not going to be like, you know what, Timmy?
Yeah, exactly.
You're right. Mom did say she wanted to die based off that one night in
Exactly.
August. So in the practical world, I don't think that really
So do you
resolves
guys?
anything.
Yeah.
These are theoretical answers, and these are examples. But from the hospitals that I did rotate in, they do follow these guidelines to an extent, but also they use common sense.
Yes.
And if there's one daughter that's like, "Don't let my mom die," they usually, and there's maybe one brother that's like, "Nah, actually, you can let her go." They will intubate or resuscitate.
Yeah, and obviously everything is explored, even with some subjectivity. For example, did he have a bad relationship, the son, with the mother? Like, there's a couple of like subjective things that probably the doctor would also listen to. Not necessarily be like, okay, that's why, but like you want to get the whole picture of like, why are you saying that she's DNR on DNI? Why are you saying that she's, like what do you have as backup?
All right, let's get this even more interesting. So do you guys know what the next step is? Say family members just can't agree, they can't come up with
call
a
the
selection.
ethics committee.
The ethics committee,
Nobody
which is
ever does.
never a right answer, even on the real world questions or anything, but that would be finally a right answer here if they can't come to anything. And then the ethics committee would get involved. Now, I think we might have glossed over this point, Benita. I understood what you were saying, which choose life over death, but did you read the part where they said that she's brain dead?
I
Did
thought
you
she was
say-
on a ventilator. You never said that.
Oh, did I?
You skipped it.
I said I might have read it a little too fast. Doctors believe that she would not regain brain function, so she is.
Oh, that changes.
That's it. Yeah, that's why I wasn't paying too much
Did you
attention.
say that?
I might have glossed over it
I
very
missed
quickly.
that as well. So,
I
So
missed
she
that.
is. She is.
No,
Not.
I just thought
when
she
you're
was-
brain dead, doctors can cut the plug.
Yes, doctors can eventually make.
but
the
again,
decision.
if the daughter is really begging,
No, you
the
still
resuscitating,
doctors can just.
They can, but would they?
I think they would. I think doctors are a little more. On the
What do you think, Sean? Would
side.
you have your resources? Like, again, it's all about the resources in the end of the day.
Okay,
Hospital's
for-
just like any other
Yeah.
resource-driven entity.
Again, if the daughter is asking me not to, then
How long the patient is brain dead?
I would cut the plug.
Well, again, I'd have to look into this. Why is she brain dead?
They said that she's not going to gain.
Yeah, she
brain
came
function.
in massive stroke, brain dead.
Um,
And from my own personal experience and all the data out there, very, very low percentage of people make it back from this kind of massive stroke, brain dead picture. It has happened, of course. There are people who have been in vegetative state for years and years and years, and then all of a sudden they regain consciousness. And some of that stuff, definitely medicine doesn't even understand yet. But for the vast majority, brain dead means brain dead.
yeah, I agree.
So what would be beneath your?
I would say at that point, yeah, I didn't hear that part.
Yeah,
I thought she was just
that's why I must have
ventilated.
glossed
Again,
over
but
that.
you still wouldn't just
the
pull the plug. You would probably involve the ethics committee in this
Right,
situation, get
right.
them to make a decision.
Right, exactly. But Benit's right in that the doctor can make the final decision and say enough is
Yeah,
enough.
I think so.
So let me tell you guys about the outcome. Very interesting. This is what I said. The family ones get a little dicey everywhere. Until the legal and ethical issues could be resolved, the ethics team told the children that a do not resuscitate order would not be put in place. They also told the children that there was nothing more they could do for the mother to reverse her condition. In the course of the consultation, the siblings discussed how their mother responded to the Terry Schiavo case. They remembered their mothers thought that it was terrible. They should let that girl die in peace. They recalled her saying. Everyone, including the sister who had initially rejected the idea, agreed that the mother should not be resuscitated in the case that her heart failed. She died shortly thereafter. So you were actually correct. You would choose life. Same thing with Shaman. You wouldn't immediately pull the plug. You guys were absolutely on the right track. Keep their do not resuscitate order would not be put in place. She'd still remain resuscitate in case her heart or anything stopped. And they kind of sorted it out and came to a conclusion finally. But if the conclusion does not get made, then Benita, you're absolutely right as well. The doctors can say the resources are not for anything and pull the plug themselves.
Yeah. Although I do have to rewind the tape and see if this guy mentions.
I read it a little too fast.
Emphasize it.
I have a list, folks.
Also, I was going to say that I think there's a huge amount of actually influence and responsibility on doctors more than people realize, and how much influence they can have on convincing patients to go DNR, DNI, and vice versa. And that's unfortunately a conversation I have not mastered or even gotten close to, but it is really common, and you can actually sway families. So
even myself as an intern, already been through the CCU countless family meetings already on whether what post DNR status, who gets ventilators, things like that. It is absolutely insane right now. So let's move on to the third case, and this is where we get interesting with this case. Okay, a girlfriend wants to receive her dying boyfriend's sperm. Well, let's just jump into it. A 25-year-old man was out drinking with his friends when he fell and hit his head on the bar. He was rushed to the hospital. Doctors discovered he had severe swelling and bleeding from the brain. Before the doctors declared him legally brain dead, the man's girlfriend arrived and asked for a testicular biopsy. Interesting. She wanted to retrieve his sperm before he died so she could conceive his child. Wow. The doctors had to decide whether the patient would be granted her request. This is a fascinating case. What do you guys immediately have impressions on? It's funny, but also, would you do the same thing? It's something that, very interesting proposition
that never has come up before in my experience.
Yeah. First impressions, what do you think? You're the doctor standing there, she comes in. Shaman.
I feel bad.
Oh, it's beneath. Okay,
no,
Shaman, go ahead.
I feel bad for her.
Again, I would, because when you're a doctor, you're always looking out for your patient, and in this case, your patient is the one who's brain dead. If you read it correctly this time.
No, I think he died. Right? Is he dead now?
He is going to be determined brain dead. Not yet. They haven't determined him, but he is. It says here, where doctors discovered he had severe swelling. Before the doctors declared him legally brain dead, the man's girlfriend arrived. So he's not legally declared
but he's in dire straits here.
You don't look too
again, but he's your patient, so you need to look out for the wishes of him. Mm-hmm. So if there is evidence of him saying, I really want a kid with you, or if this happens to me, then get a biopsy or whatever, then in that case, if there is evidence presented, maybe, again, I'd have to look at more details. I'd have to see, I probably involve the ethics committee again. But if there's
gonna be the guy who calls the ethics
Get the ethics committee! Get the ethics committee!
If there's no evidence of that, or even weak evidence, then I would not do it.
Okay. But what would you do?
Similar to Shaman, I think it's a really great point Shaman brought up, that at the end of the day, your patient is your priority, and I'd probably involve parents, because she's asking for a lot. So, I don't know if I would involve parents, because that's HIPAA, so...
I would probably, but again, this would, in general, I would say that this is not going to happen in the vast majority of cases, but if all these pieces align, I would have to get a lot of people involved. I would have to see evidence. Maybe, but I've never seen this before, and I'm leaning towards no. But keep going.
I would probably say that if we have not determined him brain dead, I don't want to go to any real decisions until I've
That's true. That is a great point.
Because you can still retrieve his sperm when he's brain dead. If there's a chance he's going to come back, then I wouldn't want to do that biopsy, because you're consenting somebody to a procedure that they have not consented.
That is also true.
And I would look who's his power of attorney to make this decision for him. Is she his power of attorney in the case that he is brain dead to do something like this? Otherwise, she can't give consent to a procedure for him. I would just wait until we figure out he's vegetative. If he's vegetative, and like Shaman said, I'd probably need to see evidence of some sort of.
So I think overall we're leading on this from what we did out. There's too many. There's too many variables that need to line up. So it's probably going to be a no. But let's say if there is some evidence saying, if I fall off a bike and get into a vegetative state, please perform this biopsy sign. Maybe in that case, but otherwise this is a no for me.
Okay, very interesting you say that. Yeah. So let's get into this one. The first thing to determine is, does the man have an end-of-life plan in place? Does it mention anything about his girlfriend? The man has no such plan in this case. The question then becomes, was there any reason that he would give his girlfriend his sperm? I was trying to look up for any other word that wouldn't be derogatory, but they're all bad. Okay. The girlfriend would have little claim to the patient's sperm. unless there is compelling evidence about this man's desire to participate in his own posthumous reproduction. Whoever wrote
exactly what I said.
Exactly. If there is written document about it, such as, like Shaman said, if I pass out drunk and one night hit my head, you have my sperm, that's a different story. But if it's just her saying that to you, it's not.
Instead, even if she remembered a conversation like that, you can't. That doesn't mean you.
That's what I was just about to say.
Yeah, unless there's
I said if it's written evidence, that's fine.
Exactly.
But
if it's written,
if it's just verbal or oral. If it's just verbally said and she's just telling you, oh, this is what he told me, that is not clear evidence of the patient's wishes. Because you might be already now guessing with these ethics things. How do you know if, like in that previous question, mom really said that about that during the ER show? It's not clear evidence.
Read the last.
So basically, I got it exactly.
I like
right.
the last sentence. Just read the last sentence.
Oh, exactly. No, that's what I was saying. So the key is why you have to be very careful with some of these ethics questions. Stuff will happen out of left field that you would never even expect. So let's say that the girlfriend managed to go ahead and secure the sperm and has a child and has an heir of this individual. This heir is now entitled legally to the patient's part of the patient's estate, just due to legal inheritance. And you just gave the estate away to somebody that just sneaked that right out from under you. So a lot of stuff that you have to take into account. So obviously what happened was there was no end-of-life plan in place. The final decision fell to the man's family, who were initially open to the retrieval as a way to continue their son's legacy. The ethics team then met and explained their concerns about the girlfriend's request. They also suggested that another way of giving new life was through organ donation. The patient was officially declared brain dead later that day. The girlfriend and parents thought about the decision overnight and came to the conclusion that they didn't want to harvest sperm. Instead, they consented to organ donation, and after the ventilator was discontinued, the man's organs were transplanted into 4
really
people.
Cool.
That's really cool way to kind of solve.
Your ethics committee did something.
They came to the rescue again. The ethics community, man, I gotta go meet these people in my hospital. I've never even seen them. We kind of just take care of it.
Guys, one thing to know is when we are, I feel like every answer for this video, me and Shaman are gonna be very wishy-washy, because at the end of the day, maybe he did say that, but you can't be insensitive to someone, even if it sounds like an outrageous request, to someone who's like very vulnerable coming in. So like, even though mine and Shaman's both were like, no, we still try to look for options and avenues to explore every perspective, because I mean, at the end of the day, they're all going through something. So all answers are going to be wishy-washy. So.
I didn't have a wishy-washy
Not
answer.
wishy-washy, but we all both didn't just go like, no, we have to
it's
like.
a compassionate answer.
Exactly.
Okay, we're going to do one last final case here. Okay, last case, guys. Make sure you guys have been commenting down below. I'm definitely going to read them and respond to them, and let's see if you got them right. So, the last case. A dying homeless man refuses treatment. A homeless man enters your hospital. Chronic gangrene osteomyelitis diabetes, very common picture. Doctors could tell that he had a psychiatric condition, but the patient refused to have any intervention. He didn't allow doctors to treat him with medication or submit to a psych evaluation. He claimed to want to simply be fed, given his insulin, and have a bed. He was also difficult with the nurses, throwing urine at them, making them generally uncomfortable. Doctors tried to coax him into accepting IV antibiotics, but he refused. The choice was send him back on the street, a possible violation of the first do no harm oath, or seek a court order declaring the man incapable of making decisions, essentially forcing him into the doctor's care. Where do you guys stand? What would you do?
Well, what's his psychiatric condition? I would need to know that.
Usually there's no specifics. Usually they're talking to themselves. Usually just saying random stuff.
There's always specifics. Is he schizophrenic?
But they're not going to be. You're not going to be able to diagnose a homeless man that just comes in.
Of course I can. I'll consult psychiatry.
Yeah, there's a couple of things. As a physician, you always have a lot more tools at your disposal than you think. Mm-hmm. So one of the things that you want to do is look at this guy's past medical history. So everything as a physician is usually in the charts if they've had any visits to the hospital in the past. And so often you can, if they're difficult to work with, you can find out, oh, they have schizophrenia and it was documented and treated in the past. So that's one of the first things I would do. And then I would get a psych eval, although it looks like he did refuse a psych evaluation, but still, that's what I read. That's what I read.
He's a psych condition, but the patient refused to have any intervention, which assumes he doesn't want to talk.
Interventions, but
likely he won't talk to a psychiatrist.
The psychiatrist can do a sort of evaluation without being like interventionist.
And I will also let you know that patients like this, psych usually does show up, says patient uncooperative, will assess at a later time, at least where I've been at. Yeah.
Also, I feel like even involuntarily, the psych hospital I was at, they usually have a diagnosis when upon presentation in the ER. When
That's a good psychiatrist, man.
Really?
Yeah. Usually it's more, you get psychiatry on board, they manage medications for acute agitation or something like that, and then they assess the chronic condition at a later time when they're more stable.
I guess you're right.
This
That's what I
patient
would do
also
with
is
him.
not stable.
That's what I would do with him.
What?
I'd give him some haloperidol, tell him to get him to calm down. He's not capable of taking care of himself. He's got gangrene osteomyelitis, which would probably kill him. Mm-hmm. I would, give him haloperidol, something to deagitate him, and then probably involuntarily admit him. Because he's not capable of... I'd also order psych consult, but like you said, it'll probably be uncooperative. And then at a later time, once he's deagitated, get psych to reevaluate. Most likely they'll come up with some sort of, unfortunately for his case, probably that he's, doesn't have capacity, and then treat him. I would treat him preemptively, though, while he's in my care.
So you would treat him without doing a court order or anything like that?
Yes, because he's acutely ill.
He's acute.
He's got osteomyelitis and gangrene.
Okay,
Yeah.
That's actually a really respectable answer to that, because sepsis infection, one of the earliest things you could do is get antibiotics into the system. That is the number one thing to decrease mortality. Go ahead, Chum.
Yeah, so I basically agree, and I think this is more common than you might think in the ER. Like, people are like, oh my god, you're giving a patient medications when he refuses them. This is really common, and if we did absolutely nothing about patients who come in that are refusing treatment, especially ones that are need a psych evaluation, then we'd be in a lot of trouble. So even at some hospitals I've seen, there's like a psych component of the ER. It's like joint, because this is so common. So because he does have these acute conditions that do need treatment, you can't just let him back out onto the street. That's kind of, in my opinion, that's wrong. And although I have seen that happen at, like, when I was shadowing in college, people are just like, oh, I'm sick of these homeless people. Just get him out of here. He's been here 10 times.
Yeah, they'll do like NSAIDs or something very temporary.
Yeah.
And then, like you said, get them out.
Yeah, but I don't agree with that. I think he does need treatment. And I basically agree with Benit's answer generally.
Yeah.
Okay, so this is what happened. For a busy staff...
Watch us be wrong.
There's no gray area here, actually. Obviously, you guys are spot on. Discharging this very sick man to the street to die is ethically unacceptable. The dilemma now becomes how to respect their desires to actually treat the illness. A patient has the right to be mentally ill, but we do not want a mentally ill person to suffer because his illness tends to make him say no. Doctors have to determine if the man can make his own decisions. That's really key here.
Essentially, by the way, especially if you're considering going into medicine, it's a good thing to know what capacity really means. It sounds like a subjective term, but there's actually certain criteria that have to be met to determine if somebody has or does not have capacity. Do they understand their medical problem? Do they understand, okay, I have osteomyelitis, which is an infection of the bone, like due to a bacteria. Can they recite that to you? Do they understand the basics? Do they understand the risks of not having treatment? So, hey, okay, if I don't have treatment for this osteomyelitis, it could turn septic and I could die. They need to be able to recite that back to you. And then they need to understand what the proposed treatment doctors are trying to give them. So, hey, we're going to give you these antibiotics for your osteomyelitis. This is what they're going to treat. Here's some side effects of it. They need to understand what the treatment is. Because sometimes you'll even have maybe natural, patients who really like herbs, right? They don't want any pills. But they need to understand, okay, this pill, this is what it's going to do. You're not, and if you don't get this pill, the alternatives we have are these. So they need to be able to recite all of this back to the doctor before somebody can say, okay, you completely understand that this is going to kill you. You completely understand this is the treatment we were going for, and these are your alternatives, and you don't want any of these. Okay, you're free to go.
Yeah.
So you guys were right. In this case, psychiatrists can also be called in. It also varies state by state. I know in New York, you need 2 physicians to kind of approve to treat somebody and hold them against their will in a psych unit. And then, like you guys said, treating somebody that doesn't have capacity, you can do it with a court order and then actually treat them. So in this case, the ethics team enlisted the help of a psychiatrist who came in, exactly like you guys had said, to see if he had decision-making capacity. She was able to have a conversation with the patient that made clear he was not capable of making decisions. The man allowed doctors to call his mother. She confirmed that the man had a mental illness and encouraged the hospital to force him into care. The hospital was granted the permission from the court to treat the man against his will. After 7 weeks of medical and psych treatment, he was released into a chronic care facility under the supervision of his doctor, who continued to act as his surrogate. Yeah. So, bam, you guys actually were spot on with most of these. How did you guys out there do? Very interesting cases, and it just goes to show you being a doctor is just endless angles you can take to it. This is stuff you have to deal with on a day-to-day basis. This is not some rare thing that happens. Yeah. So, overall, you guys did really, really well. Shockingly, I thought really some of those were going to trip you up, but you guys did good. Did you guys out there have the same opinions? Do you even agree with this? Because ethics is something...
Why do you sound like Blue's Clues? Did you guys get it? Did you guys do it?
Yes. In the end of the day, one important thing to note is, yes, these are really, really smart people that put this together and look at it from every angle, but people have different ethics. Things are subjective. Do you guys agree with these answers, or would you do something even different, and what is your logic? We will be looking for your comments down below, guys, and thank you so much for tuning into this video. We will see you guys in the next one.
Later.